Take a deep breath. Focus on the sensation of your chest expanding and your ribs flaring outward as air fills your body. It is easy to assume the lungs are doing the work, that they are reaching out and pulling the air in. In reality, human lungs are passive. They are dense, fleshy sponges that contain no skeletal muscle tissue. Lacking muscle, the lungs cannot generate the mechanical force required to move oxygen. They are incapable of moving themselves. If the lungs cannot pull air in, some other biological mechanism must perform this labor 20,000 times a day. Our physical intuition about how we move air is the opposite of the anatomical reality. To find the engine of respiration, we have to look past the skin and ribs, into the protective environment of the thoracic cavity. This anatomical model shows how the rib cage shields the vital organs, the lungs and heart. Beneath the lungs sits a reddish, parachute-shaped muscle. This is the diaphragm. It acts as a physical boundary, separating the chest cavity from the digestive tract below. In its resting state, this vital muscle curves upward into a dome shape, pushing into the space under the lungs. This structural boundary layer provides the mechanical force driving the entire respiratory system. A breath starts when the brain sends a subconscious signal. The dome-shaped diaphragm then contracts and flattens, pulling the base of the chest cavity downward. This movement follows Boyle's law. When the physical volume of a closed container increases, the internal pressure drops. As the diaphragm moves down, it expands the volume of the chest, creating a low-pressure vacuum inside the body. Because the atmospheric pressure outside the body is now higher than the pressure inside, air rushes in through the nose and mouth to fill the vacuum, passively inflating the lungs. To exhale, the diaphragm relaxes back into its upward dome shape. This shrinks the chest volume and pushes the stale air out. Respiration relies on this internal vacuum that the outside atmosphere rushes to fill. Returning to our original question, we can now identify the diaphragm's primary biological function. The diaphragm acts as a volumetric pump rather than a chemical processor or fluid transporter. This excludes digestion, circulation, and excretion. Out of these four options, breathing is the only correct answer. Without this downward pulling pump, the pressure in the chest would never change, leaving the respiratory system static. Take one final deep breath in. Feel the physical drop of the diaphragm, the vital pump that keeps you alive.